Well, I would like to use this moment to be able to present our guest speaker for tonight. So Dr. Kseri, he's a dually board certified internist and pediatrician. He earned his medical degree from Michigan State University's College of Human Medicine and completed his residency and training at Beaumont Health. Throughout his career, Dr. Kseri has worked on projects to place preferred pronouns and names in electronic medical records, provide a comprehensive list of LGBT-friendly providers, and secured sponsors for all of the Pride events in the Metro Detroit area. He has most recently served as a chief resident for the internal medicine residency program at Tallahassee Memorial Healthcare for the Florida State University College of Medicine during the 2019-2020 academic year. He continues to be interested in underserved LGBT plus populations and hopes to focus more on adolescent health in the future. So without further ado, I would like to give this platform to Dr. Kseri. You could go ahead and take it away.
Thank you. Thank you for having me. I want to kind of start off by giving you a little bit of an overview of how I got to be MedPeds and what is MedPeds and how do you make it all the way to become kind of in the position that I'm in today. So I went through med school. Let's go back. I went to undergrad. My major was biology and I had a minor in chemistry. Then I went to med school in Michigan State. And then after med school, I really was being indecisive about what I wanted because I liked a lot of things. I went into med school thinking I'm going to be a surgeon. And then I met a couple of surgeons and I worked with a couple of surgeons. And then I realized I'm not going to be a surgeon because I just don't vibe with those kind of people. And then I wasn't quite sure what I wanted to do. And then a doctor I was working with said MedPeds, and I've never heard of the word MedPeds. It's short for internal medicine and pediatrics. And he made a very good case for it. He said that, you can do MedPeds or you can do family medicine, but the difference is family medicine is a specialty in itself. This is someone who trains for 3 years and does a lot of work, what's called outpatient, which is in the clinics basically. And he said, you can do that, or you can do MedPeds and become board certified in 2 different specialty. One is pediatric, one is internal medicine. And if I did that, I had opportunities to do then fellowships in pediatrics or fellowships in internal medicine. So I could have gone on to become a pediatric cardiologist or an adult cardiologist. If you do family medicine, you don't get those same kind of opportunity just because fellowships don't work like that. So ultimately, I felt like that would be a good fit for me. I really liked working with kids, but I felt that I needed to talk to adults sometimes so that I understand what they're saying, because when you take care of kids, sometimes all they do is cry and you kind of have to guess what's going on. You really don't know. Whereas adults can tell you, I'm having belly pain, I'm having chest pain. It makes it a lot easier to take care of kind of a diverse patient population. We kind of talk about it, joke about it, that MedPeds, we take care of you from 0 until 100 or 120, however old you get. The only thing that I don't do and I've never done is what's called OB-GYN, which is me handling deliveries or I am present in deliveries as a pediatrician, but I don't do the delivery part, which is what sometimes family medicine doctors do. Questions about a lot of information that I just given you. Question about the process. Okay, so oftentimes I get asked, so now in my current job, what is it that I do or what does my day look like? So I currently work in what we consider outpatient medicine. So I don't round in the hospital. I don't work in the hospital. Majority of what I do is outpatient. I see my own private patients. I see adults, I see kids. And I do that for about half of my time, so half of my week. The other half of my week, I go to med school and teach there. I'm right now the clinical skills director for the second year medical students. So what I do there is basically when you go to med school, one of the things we try to work with you on is teach you how to interact with patients in kind of a real way. So to achieve that, we have what's called a simulation center. And basically we have a bunch of fake patient rooms that are next to each other. And there are a couple of different cameras, and basically we have volunteers that come and act like fake patients, and we have different scenarios that we train them on, and our medical students basically play the doctor in this scenario. And what we do is we evaluate the students on their ability to talk to the patient, on how well they perform their physical exam. And then if there is part of the activity that has a skill, that's where you do it. So we teach students how to do stuff like lumbar puncture, which is how you get fluids from the spine. We teach them how to do injections. We teach them how to do suturing. We teach them a bunch of different skills that would be helpful for you as a clinician to kind of be at least familiar with the basic stuffs until you become an intern. And when you become an intern, you tend, the learning curves goes up quite a bit, because then you're responsible for real patients and you're not kind of under the umbrella or under the protection of the med school. Question about any of that, or just any generic questions? Y'all are a quiet group. Becoming what, a pediatrician, a doctor, or in general? So for me, it took me 13 years. It's 5, 4, and 4. Yeah. So it took me 5 years to finish undergrad, because I did a major in biology, but then I did a minor in chemistry. So that added a year for me. Med school is 4 years. So that's pretty much across the board. And then residency depends on how long your residency is. So if you actually just wanted to do pediatrics, pediatrics alone is 3 years. But med peds, because I did dual specialty, it got caught up into 2 years in each. So I ended up doing 4. If you're doing something like surgery, that's 5 years of residency. So how long your residency is depends on what you end up deciding to do. Becoming a doctor it's kind of hard. You know, you have to, I'm also on the admissions committee, so I do look at applications for folks interested in coming to med school that apply to FSU College of Medicine. And, you know, progressively applications are stronger and stronger. So med schools are not just looking at grades, because having good grades doesn't necessarily translate into becoming a good physician. So if medicine is something you're interested in, make sure that you enrich your resume right now with stuff like extracurricular, stuff like volunteer, community engagement, shadowing. I worked in a rehab, I volunteered in a rehab floor for almost a year while I was preparing for med school, because that gave me a lot of things to talk about in my interview trail, which made me look more of an attractive applicant. So I would say that right now, the hardest part, you know, if you have the grades, then you have the intellect to do well in med school. But making sure that you are a well-rounded applicant is not something easy to do. So make sure that not all your focus is strictly towards grades. So the way you do med school is at least the way I did med school, and that's how it is at FSU, is that you do your 2 years of preclinicals, which means those are 2 years that you pretty much spend it for the most part on campus and you are learning, you have some patient interaction, but not a lot. And then the second 2 years of med school is where you do what's called rotations, which is when you're trying to figure out what you like. So you go for 8 weeks, let's say in family medicine, and then 8 weeks for internal medicine, and then 8 weeks for pediatrics, and 8 weeks for psychiatry, 8 weeks for surgery. I don't know if I said that. So you have about core, I don't know, 6 to 8 rotation that all the medical students do. And they're intended to be in your 3rd year so that if you're not sure what you want, what kind of doctor you want to be, you get to try each specialty at least for a little bit so that you figure out if it's something that you're interested in. And so when I did my surgery rotation, I did a lot of open abdomen surgeries where, you know, we did appendicitis, we removed gallbladders, we did hernia repairs, those kind of things. And then for my elective in my 4th year, actually, I picked something cool. I picked reconstructive surgery. So I worked with a plastic surgeon for 4 weeks, which was kind of cool to see a different kind of surgery. Besides biology and chemistry, what other courses would be recommended that would help in the process? To be honest, you know, aside from your basic sciences, I don't know that you, aside from the basic requirements to get you into med school, I don't know that you need to go above and beyond in terms of necessarily becoming a biology major. I mean, being a biology major did not hurt, but it's not necessarily the only route that you need to go in, because a lot of the stuff you're gonna, I mean, sure, you can learn it in undergrad, but it is gonna repeat in med school. So it's not like you're missing out if you don't, you're not missing out if you don't pick a biology major. You can really do whatever it is that you want. And honestly, sometimes if I see on an applicant that they have an interesting major, that might pique my interest to kind of read through the application more. That being said, I mean, I fully admit I was a biology major, so hope that kind of answers the question. Any other questions? For me, language barrier was huge. English is not my first language. I moved here from the Middle East, so my accent is not very thick because I picked up my English from the Fresh Prince of Bel-Air, Seinfeld, and Friends, all these TV shows. But my vocab was not great. So even though, I mean, I studied everything in Arabic up until the age of 18. And I had to kind of flip my brain when I moved to the US and start, you know, learning X and Y and kind of translating things in my brain. So that happened for me. That was a challenge for me, even up until the point of getting to med school. And then once I made it to med school, it didn't really matter because, to be quite honest, I did not know any medical terms in Arabic. So it didn't matter in terms of translation. I was learning brand new information in English. But with time, with studying and with, I guess, practice, my vocab got better and it made it easier for me. But it still presented challenges and stuff like taking the MCAT. I had to take it twice. Even taking examination within med school, I'm a very slow reader because of English being my second language. So there are times that it made it a lot harder to kind of keep up with the pace of everyone else. But given my position right now, being a course director for medical students, it kind of shows you that even though you struggle, sometimes you can achieve success if you persevere. What type of GPA do you need to keep? So that's a good question. It's a good question, but it doesn't. So let's put it this way. Med schools, when you apply to them, have sometimes cutoffs. So some med schools have a screening process where they say, like, we are not going to look at any applicant with the GPA less than 3.5. And so if you are 3.4, regardless of how good your MCAT is, you might not get invited to that med school. Some med schools don't do that. They look at an applicant as a whole because maybe you didn't know that you wanted to be a doctor at an early stage and then later on decided on that and you tried your best to catch up with the grades, but 3.4 is what all you were able to achieve. So I would say a well-rounded application is best. I will say full disclosure, I think the reason I ended up in med school is because of my GPA, because I had to take the MCAT twice and my MCAT was not that great, but my GPA was rock solid. So the combination of my MCAT and my GPA made me a good candidate. In terms of getting into med school, I shouldn't say it wasn't hard. It wasn't easy. I maintained a pretty good GPA. I took the MCAT twice, improved from first to second time, but it wasn't, crazy number. And I knew that I wouldn't get a crazy number because of the language barrier and because of my test taking abilities. But in the same time, I had volunteered in a hospital for over a year. So I had think over 1,000 hours on my application. I had gone on mission trips. I had shown kind of community engagement. I I went and shadowed an ambulance. A friend of mine was an EMT, so I went on the ambulance with her a couple of times. And doing stuff like that, again, that's what I was talking about with being a well-rounded applicant, is when you have those kind of things, people are always intrigued about what you've done. And for me, when I added my minor in chemistry, I also started teaching at the university. So that was another thing that I could talk about during my interviews, is how I enjoy teaching now. And honestly, that's part of the reason we're on this call today, is because when I realized I like teaching, I knew that one way or the other, when med school is over, I'm going to be involved in academia. And that's why I work for FSU's College of Medicine. So I don't know if there are organized efforts specifically for high school students, but a lot of times, at least my experience, even as an undergrad in shadowing, I was just reaching out to folks. Like, I pulled up a list of family medicine doctors in my area, and I was just calling the offices and saying, hey, my name is Ramiz Kseri. I'm a pre-med student, and I'd love to see if Dr. So-and-so would let me shadow. And I lucked out. I actually still remember his name, Dr. Pepler, and he was great. He let me shadow. He actually did the coolest procedure I've ever seen to date, where he let me go in on the surgery with him as a pre-med student. He performs, I don't remember the name of the surgery, but I can describe it for you. Basically, the idea is people that have very severe back pain, they put those very, very tiny metal wires in their spine, and they attach them to a stimulator. What the stimulator does is create a numbing sensation in your back. So your brain does not perceive pain, it just perceives the numbing sensation in the back. And I saw him do it multiple times, and the results were so cool. There was a 72-year-old woman that she was miserable before the surgery, and she came and saw us like a week after the surgery, and she was talking about, oh, doctor, I was dancing in the kitchen and I was making food for my grandkids, and it changed her life. All of this to say, I was able to have this great, great experience that made me love medicine even more, just by applying effort and kind of reaching out and seeing what I can latch on to. Going through the general process, it's very layered. So I think the very first step that's hard is making you look attractive as an applicant to get to med school. So as I said, volunteer experiences, anything to kind of enrich you, who you are as a person. I also encourage you to use a lot of people around you to proofread and give you input when it comes to any kind of personal statement that you write up for med school interviews, because on the receiving end, having read, I don't know how many, a lot of times if I'm reading the same story over and over again, sometimes it doesn't make someone stick out. So a lot of people wanted to be a doctor from they were little. So that becomes not unique per person, but then sharing a personal story or sharing a personal connection that you had, whether with a family member or with another person or something that kind of ignited the interest in healthcare, those are the kind of things that make your application more exciting. Also, letting me know who you are versus telling me who you want to be. So you telling me I want to be a doctor, that is great, but I need to know who you are to know if you're a good fit for our program. So sometimes when I mentor students, I let them know one of the best ways I've read and have learned to do those personal statement is the whole intro, outro, and 3 characteristic paragraphs. So in the intro, you kind of, I'll give you an example of mine because it's kind of dumb, but my intro was talking about how again, being an immigrant, when I first started college, I went to Comp 101, and the professor at the time said, please don't write about abortion or euthanasia. So I said, cool. I wasn't gonna write about those things. And then I proceeded to write my final paper about merciful killing. And I submitted it. And she brought me to the side and said, you know, Ramiz, this is a really good paper, but I thought I was specific in the beginning of semester. I said, don't write about euthanasia. Well, for my foreign self, I thought she was saying the youth space in space Asia. So I had no idea why we were not supposed to talk about the kids in Asia, and I didn't talk about the kids in Asia, but it turns out there is a word that I didn't learn in English yet, which is euthanasia, one word. So putting this story in the beginning and latching onto it at the outro where I say, and now I've learned a new word, and ending with euthanasia. I can't tell you how many times in interviews people left and asked me questions, like, oh my God, I've never thought of it this way, the youth in Asia. So it became a joke, or it made me memorable for the people that were interviewing me. But then aside from story that is interesting and hooks the reader, the meat of the statement was based on 3 separate paragraphs. And in each paragraph, I put a unique characteristic or a unique story. So I would give them a story about when I helped with something. And in telling the story, I am demonstrating a skill. So maybe the skill I'm demonstrating, you know, I'm showcasing to you how how I have leadership skill. Maybe in the other paragraph, I show you how I have resilience. Maybe in the 3rd paragraph, I show you how I have good teamwork ethic. What ends up happening is when you write a personal statement that looks like that, if I read something like that, it sticks with me. And I remember a lot of, this goes true for students and for residents, because I've also interviewed residents or applicants for residency. And a lot of times when there's a fun story like that, I remember it. And I even write a note to the side of the application, oh, story about soccer or story about ballet. Someone talked about a story about going fishing. So pay attention to the personal statement, because when you're getting screened with thousands of other people, sometimes how you write your narrative could be the only way or the only opportunity for me to get to know you. And if I feel like you blend with the crowd, it might be hard to advocate for you in an admission committee. So make sure that your personal statement sticks out. So I would think that that probably is one of the biggest thing, at least headed in that direction. Reiterating the volunteer stuff and beefing the resume as a whole, that's kind of the biggest challenge of getting into med school. Once you make it into med school, the next step is residency. And residency is a little bit different because it goes through a matching process, and the likelihood of matching is actually pretty high for students. It's just a matter of how high on your match list do you rank. So the way it goes in residency is that, let's say you apply to 20 residency and 10 places offer you an interview, you have to rank those 10 places in terms of 1 being the one you want the most and 10 being the one you want the least. And then on match day, there's an algorithm that matches students and their respective hospital based on the best match. Also, the other thing, when it comes to shadowing, because I'm circling back to making sure I read some of those questions, hospital systems can be a very good place for you to decide if you want to be in medicine altogether. So one of the things I did in terms of volunteering, I think I was on the transport service for a while, and I was on cleanup another time. It is very insightful for you to be inside the hospital, because you can have the vision of, oh my God, I really want to be a doctor. But then when you actually go through it, like, yeah, maybe that's not for me. And I think that there is power in that too. Just because you have an expectation or just because you have an expectation of what you should be doesn't mean that that's the way that you have to be. It's okay to go into medicine and even make it all the way to residency and decide, you know what, it's not for me, because your own mental and physical health should always come first, not necessarily the aspiration or people pressure around you, whether it be society or family. What was it like when you first got to working with patients? Terrifying, because especially as a student, you feel like you don't know absolutely anything. So you're always fumbling over your words. I remember when I started residency, and for the first month when nurses would say Dr. Kseri, I would have to like turn around like, you're talking to me. Like, I don't know what I'm doing. I barely know how to order Tylenol. So to ask me question and figure out what to do with a patient was something like I could not comprehend that I knew. But I think with time, you start feeling more and more comfortable and realize that patients are also humans, and you realize that you know a little bit more than what you think you know. In terms of finances, so med school, depending on where you go, can be a little bit expensive. So it depends. It depends, generally speaking, like if you're staying in the area, if you're going to a state school, if you're not going to a state school. I don't know currently what the tuitions look like in terms of med schools. Usually, I mean, on average, if you're considered in-state versus out-of-state and where you are, med schools can cost anywhere between 200 to 450,000 for the 4 years. You are able to get pretty much student loans to cruise all the way through it. When you are, it's a little bit different because you can also offset this by scholarships. That's very easily done, but the cost of med school makes scholarships kind of drop in the bucket because it's so expensive. Very different personalities. People joke like pediatricians are kind of the lovey-dovey kind. The radiologists are like the cool guys. I think you're going to meet variety of personalities, but that could be a good thing and a bad thing. The healthcare system is definitely not where it needs to be in terms of inclusivity and diversity. So you not uncommonly run into people with different ideologies, and You have to develop skills over time to learn how to communicate with peers, patients, colleagues that you don't see eye to eye with in a respectful and kind of engaging way. And that's not easily done, but that's an important skill because that's the only way for you to succeed and thrive. You're not going to get along with everyone. Other questions? So far, very good questions, y'all. Honestly, you have to be somewhat flexible. You have to be able to honestly be honest with yourself, because like I told you, if you are not confident in your ability to do something, don't feel the peer pressure to say yes because someone else is saying yes. So there is a sense of humility in medicine when you admit what you don't know and try to improve upon yourself. But there's also a level of very type A personalities amongst a lot of students sitting in a very small space. So everyone wants to be, A plus, doing their best. And being able to be honest with yourself, knowing what your strengths are, knowing what your limitations are, and working at your own pace, it's probably the best skill that you can have. In addition, being comfortable and accepting that if you are the type of person that needs to know everything about something, medicine is not going to be it for you because you'll never stop learning. It is one of those specialties that once you go in it, medicine is always changing. Guidelines change, treatment change, and if you want to be a good doctor, you have to practice evidence-based medicine, and as such, you're constantly learning. So flexibility is also a big one. For me, medicine was kind of a process of elimination because I really like biology, and I also really liked art. I am a portrait artist. I draw pencil portraits. And so when I was growing up, because I liked biology and I liked art, I really thought that I was going to be a reconstructive surgeon because it married my two passions. But like I said in the beginning, after I started surgery, I realized I don't have the personality for that kind of specialty. And that's why I kind of pivoted to primary care. I can specialize if I wanted to. And I think when I started my training, the reason I did med peds and not family medicine, in case something tickled my interest, something like cardiology, endocrinology, whatever those specialties are. But ultimately, what I like to do the most is to teach. So as far as my career goals, I think I'll continue to put my focus on academic teaching because I think academia is so powerful. One good teacher can impact an infinite number of students and medical students. So I think our energy should go into practice just as much as teaching. Probably what my husband does. He's a therapist. I think I probably would have still been medically aligned. I think we're finally given mental health focus. And to be honest, in my job as a primary care doctor, I kind of half work as a therapist because sometimes I'm the only person that the patient wants to see and they don't want to go talk to someone else. So I think therapy and focusing on the impact of trauma on someone else's well-being is pretty important. Set boundaries in terms of what? Like in terms of your relationship with your patients? or yeah, I mean, it can be challenging. You just have to be respectful and approach people with dignity and respect. So you very politely have to, it goes back to being honest from the get-go. If you set good boundaries in terms of what you're willing to do and what you're not willing to do, people can't come back and tell you you said this and that. So for example, when I see a teenager, I often kick the parents out of the room. But what I do is, as soon as I walk into the room, I let the parent know that later on in the visit, I'm going to ask them to leave, so that me telling them that a half hour later doesn't come out of left field. So a lot of times, if you set the stage for what you want to do in advance, you're able to kind of avoid conflict. I don't know that blatantly disrespectful. I mean, I definitely had visits that escalated. I think what you need to remember oftentimes is when people are acting in a certain way, they must be hurting on some level or are upset from something. So you're not obligated to stay in a room that you feel unsafe in, or the conversation is not going anywhere positive. So you are obviously obligated to the welfare of the patient, but your safety comes first. So if a situation is dangerous, it's easy enough for you to remove yourself. But if something is in the interest of a patient and their instinctive reaction is to lash out, I don't let the lashing out prevent me from still carrying forward with a hard conversation, because ultimately my responsibility is to the patient. And if they're willing to hear the truth, then it's my job to share it. Good question. The parents thing happen more often than you think. And honestly, it's never parents, it's grandparents. Grandparents love to tell you how much of an idiot I am. But I think that that's just the grandparents thing. And it could also be generational, because, you know, I am a lot younger than that grandparent. So they probably view me no older than the child that they're bringing. So I take that with a grain of salt. I don't take those kind of interaction personally. Though that is why in med school, I did start growing a beard so that people stopped thinking I was 12. I think the hardest thing about being in medicine, and it depends on your own personality, I struggle with having too much empathy. A lot of times when something happens at work, I easily get emotionally invested. I don't mean it, but I care and I can't help that. So when I was in training, taking care of cancer kids was probably the hardest thing I had to do, because I had to have conversations about end of life, and I had to be there when a baby died, and being able to show empathy and then distance yourself is not something I ever did successfully. So I always used to struggle when we lost a patient. I mean, I still do, but I think that's just a personality thing. Absolutely. I mean, burnout is real. I'm currently in therapy. You have to take care of yourself. You can't just talk the talk, you have to walk the walk. So if you don't take care of yourself, you really can't take care of other people. And as long as you are honest with yourself, as I said, from the get-go, with your emotions, what your capabilities are, and what you're willing to accept, I think you'll be a lot happier. Don't try to focus on you know, what people think you should be or what you perceive people think you should be. If you're honest with yourself, if you prioritize your mental and physical health, it makes it a lot easier. But it is an emotional job. You're dealing with people's life, and sometimes I'm the only person that this patient is seeing. So they put a lot of their trust in me, and I take it very seriously. There's definitely race-related issues in medicine. I mean, for example, my name is Ramiz Kseri. My first name hardly ever gets pronounced right, and I'm always assumed to be Hispanic because Ramiz is close to Ramirez. I don't speak a lick of Spanish. I'm Arabic. In terms of racism directly towards me, I didn't experience it much because my accent was not thick enough. And to be honest, I look Caucasian enough. However, I saw in my colleagues whose accent was not, was thicker than mine. And one of the exams that just got canceled, not just got canceled, like we don't do it anymore, is USMLE Step 2 clinical skills, which basically was fake patient encounters that you were graded on, and colleagues that had thicker accent and harder time speaking often had to take that exam more than once in order to pass it. So the language barrier part of it was challenging. It does get easier in terms of handling emotion, but honestly, your question kind of relates to the other private question I just got, which is, you know, our job is very stressful. You deal with stuff, microaggressions left, right, and center. I'm an Arabic queer person, so I have an intersectionality that makes me hated by both groups. And it kind of gets to you. Sometimes a subtle comment gets to you because somehow you are supposed to, just as a doctor, have so much resiliency, but as an immigrant Arabic queer person, you're supposed to have even more resiliency. And not a lot of times you can handle all the pressure that you're getting all the time. And so it goes back to what kind of practices do you do to take care of yourself? Meditation, therapy, yoga, whatever it is, that's how it gets easier, not that the experience in itself gets easier. Other questions? All the time, in terms of self-doubt or reconsider, but until they figure out time travel, life only goes in one way. So you kind of have, again, reassess all the time what makes you happy. And so right now, teaching is something that sparks a lot of joy in my life. So that's why academia is something that makes me love medicine more, because there are certain aspects of medicine, the politics of it, the insurance of it, the back and forth of it, that I don't really appreciate, but the satisfaction I get from teaching offsets that. I say, come with positive energy, come with good attitude, ready to learn, and don't worry about other people. Just focus on yourself. Do not compare yourself to others, because that will always make you feel some type of way, whether good or bad. So just focus on yourself, focus on your own health, and focus on your own success, because that's the only thing that matters. Looking at other people is not going to help you, but putting that energy inward will. I feel like that ends up being very good parting words too.
Yeah, no, Dr. Kseri, thank you so much for this talk. You actually said so many good points and mentioned a lot of advice, which I know it's going to help them, give them a leg up, especially them being high schoolers. You know, you said a lot of information that helps even college students, you know, pursue medicine. So thank you so much for your time and for those beautiful notes that you mentioned.
You are very welcome. Best of luck for everyone.